So you come to therapy and you're saying, I've got this injury and this problem I'm trying to address. And even if everything's going perfectly well and as expected in your therapy sessions, it's not atypical, especially on some of our more complicated patients who have more history in their body, that you're saying, I'm noticing I'm addressing my main pain spot, but now I'm noticing other parts of my body are feeling things that are sore or pain in them. And I want to make sure, again, is that okay? Is that expected? Well, again, many of you are going to find that you're very simple and they're going to go through therapy like a piece of cake. Maybe again, they have not very complicated history. But for those of you guys who say, let's say when I was 5 years old, I fell really hard and hurt my hip. And then when I was 12 years old, I hit my knee. And then when I got in a car accident when I was 22. And then when I was 30, I had a bad monitor position or something. And you're coming in with a lot of different history on your body of things that are out of whack in different directions, things all on top of each other. Well, you may find, again, as we're doing certain movements to try to address the key restriction we're seeing on that given day, because I say God connects this to this, to that, to that, to that, you may have some movements that say, that worked really well for that, but maybe there's another part of my body that said, I'm not really sure I like that you did that exercise. So maybe it was irritated by the fact you did the thing to address that other problem. That can happen. We've also talked about how even if you do everything perfectly and you walk out your door at the end of your session feeling and moving better, the body also naturally tries to tighten back up to your old injury. So some people, especially early on in therapy, get sore muscles just from the body, being readdressed back to its old spot there. So if that's the case, make sure you're consistently still doing your treatments to make sure you make it better again. But the more complicated ones, I like to explain it with what I call my layers theory, kind of like the onion here. So to help to illustrate this, I remember a patient who first made sense out of this for me many years ago. She came in with a neck problem here. And after her first 3 sessions, she said, neck pain's gone, but now I've got this new right shoulder blade problem, and that's new, and I don't like that. So at that point, I said, okay, well, let's address that. So sure enough, a couple sessions later, neck was still good, shoulder blade was good. But now she's saying I've got this new left glute and hip problem over here. And that wasn't there before. So what's happening? Am I just chasing my pains around? And I think I had a smart alecky comment on that saying something like, the patient asked, are we just borrowing from Peter to pay Paul? And I said, we want to make sure all the apostles are happy, so let's go address that. So anyway, so we addressed that. A couple sessions later, now her knee is hurting before. And I said, what is happening? Are we just chasing our tail here? And this continued until right around we were about session 9 or 10. And she came and said, knee's great now, but I've got a left foot problem. And she said, but I figured it all out. She said, I was born with something I remember from her history. So I was born with a left foot problem, something called a club foot. After some surgeries on that, she said, by the time I was age 8, I started to have a knee problem. She said, by the time I was in my teens, it had spread up here and created a lot of glute issues here. Then I said, I'd forgotten about this about 5 years ago. I had this pretty bad right shoulder blade area pain. And then I came into therapy with you addressing this here. So what we're actually doing is we're actually just going back in time and peeling back a layer. So we got rid of the more recent injury, and now we're exposing the thing from 5 years ago, got rid of that, exposed the thing from her teens, got rid of that, exposed the thing when she was 8, and eventually got down to the thing she was born with. And then while we couldn't take the screws and pins out of her foot, we actually found there were some exercises that can counteract that, and that was the last layer. She was fixed. So some of you, again, you may be noticing problems in other spots because some exercises help one thing but mess up another. We can address that. Some of you may be noticing I'm feeling things in other areas because it's trying to tighten back up again on those things. And because everything connects together, I'm not just addressing that, there's that. If that's you, make sure you continue doing your favorite therapy exercise and make it back better again. Some of you may be going through the layers of history. I'm exposing my old injuries now that we're getting rid of some more of the recent things. And the exercises for the next layer may be completely different than the things you had to do on the first layer. You might even go in the other direction now on some of these things. And just know, again, we'll walk you through that. So whatever it is, just know, again, not a shock to us when things come back later. We'll make sure we're addressing it in your therapy, but make sure, again, you ask these questions and you bring this up to us so we can address it for you.